everyone. Welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. Doctor, are glaucoma a silent killer? My first question for you is, what are the early signs for glaucoma and how can it be detected before any significant damage occurs?
One of the most important factors is family history. If somebody has a family history of their parents having glaucoma, they should definitely get their eyes screened routinely. Some of the early symptoms can be they can be mild heaviness on the brow. You can feel like, oh, my eyes are feeling very heavy. Sometimes when the glaucoma crosses, the intraocular pressure has gone above a certain level, a person might start feeling, I'm seeing rain halos. He'll say, I'm seeing colored halos, because the cornea edema happens, and when the light passes through, it feels like you're seeing a rainbow inside the eye. So that is one of the few symptoms that a person can have. Other than that, if there's a history of trauma to the eye, or a person has any secondary factors that need to be looked upon before. Other than that, these three symptoms are the most important ones.
What are the risk factors for glaucoma, and can it be prevented or slowed down with the lifestyle changes or medication?
The glaucoma can be slowed down on treatment. First of all, you have to really analyze what kind of glaucoma do you have. Do you have an open angle glaucoma? Do you have a closed angle glaucoma? Do you have a secondary glaucoma because of diabetes? It's called neovascular glaucoma. So there's different categories that it comes into, and there's a whole list of things. Preventive measures, no. Only preventive measures if you have glaucoma and you have a family history, you go for a routine checkup and you do regular visual field assessment that we don't see any visual field effects coming inside the eye. Secondly, treatment. I think nowadays there's been a huge evolution in comparison to how the drugs have come in, and there's a huge market of molecules that are available right now. So a lot of patients can go through, be safe throughout their life on just topical medications. But then again, sometimes there's a way the things work, and sometimes topical medications may not work. So you do need then surgical treatment, and the most surgical treatments available are either trabeculectomy or glaucoma drainage device, and I think those are definitely giving wonderful results. So I think a proper and a regular follow-up for glaucoma patients is very important. I think one thing I want to highlight here is, even in children who are born, they can sometimes have congenital glaucoma. So those symptoms have to be looked upon. Sometimes the eyeball is slightly bigger, and the parents may say, "Oh, look, my son has my child has such a beautiful big eye," but that needs to be checked upon. That can be both ophthalmos, and that can also be a risk factor for glaucoma.
Agreed, doctor, what you said. How often should I get my eyes checked for glaucoma, especially if I do have a family history of the conditions, doctor?
It all depends on how your optic nerve evaluation is, and it also depends on what is the visual field status. Visual field means if you're checking the optic nerve, we're checking the whole visual field of the eye, and if there are no significant defects, then we can definitely follow you 3 to 4 months. But if there are defects, and if your pressure is coming on a borderline, I definitely want to have a close 2-monthly follow-up. But that is person to person. It may be variable. If a person is all right and we're having no significant field loss and no significant increase in defects, so we may increase the follow-up. Yeah, but initially maybe a close follow-up. Yes.
So doctor, your expertise and insights on glaucoma, a silent killer, are invaluable to this initiative, and we believe your participation will greatly benefit the patients.